an indelible mark of consistent daily alignment or tattooing prevents allergic reactions to tape. C. C. Charlie. Okay. I've never actually had anybody who was allergic to the Indian ink though. It was really interesting to find out if anybody was. Prescription says to deliver 50 gray total. This is equivalent to how many rads?
D.
C?
D.
D.
Dog. Delta.
Delta? Everybody agree with that?
Unless I have it completely backwards, and then maybe A.
So how many centigrade in a rad?
Centigrade?
How many, what is, yeah, okay, tell me what.
I thought, so if a centigrade is equal to a rad.
That's right.
I'll
Yeah.
take it to
Okay,
D.
that's right, yeah. Okay, so you're still saying D?
Yes.
Okay. Everybody agree with that? Okay. Yep. The rad is equal to 1 centigrade. That's why we usually do 1 centigrade rather than 1 gray. Because it's easier for us to look at. Suitable material for skin sparing, customized tissue compensators include all of the following except. Tissue sparing compensators. Remember, compensators are placed where? Compensators are placed above the patient on a tray, 15 centimeters, like in a bulk tray, like in the accessory holder.
So then A.
Yeah. A. Yeah, tissue sparing is the one. Just out of interest, one of the companies has come out with a new type of bolus, like kind of super flap. So I've asked for a free sample so that I can show you. Okay, when operating the linear accelerator in the electron mode, cones are used primarily to electron cones or electron applicators.
C.
That's what I was gonna just.
I like
C.
C.
Yeah.
As in Charlie?
Yeah.
Okay. Everybody agree with that? Okay, I'll presume that is a yes. Yeah. The cones or electron applicators just focus the beam down. Usual position for treatment of the intact breast is, now this is something that you could do too, so, okay. So let's get what you think is the correct answer.
A.
A, okay. Okay. So you're saying A, which is supine with ipsilateral arm up and chin turned away from the effective side. Everybody agree with that? Does everybody do just one arm up? Everybody does two arms up, right?
Yeah.
Yeah, that's not the great best of options that they could use.
Yeah, well, the other one could be, and a lot of people are going to, is the prone. Has anybody seen
Yeah,
a prone
but
breast?
those ones say, one says head turned to the right and the other says toward the affected side.
Yeah,
Hey,
both
Gainesville,
said
they
shed.
have more prone breast.
Yeah, no kidding. They really do love
There
prone.
was,
Yeah.
there was more prone
Yeah.
breast there.
so with the prone breast, to keep the head straight, correct? Right.
Well, actually, in
sometimes
CT, they
it
kind of,
depends.
they just said it was based on patient comfort.
Yeah,
So if
Oh,
they would
okay.
have the two different headrests, they'd say, are you comfortable with your head to the left or right? And if not, they were like, well, try this one down. And then she was like, no. They're like, well, we can put a towel there, or whatever. She's like, okay, well,
Yeah.
I'll settle with this one.
Yeah, okay, so prone with both arms up. Now, if they didn't say anything about the head, that would be reasonable. But I've got a funny feeling that the answer they want is A. Let's see. Yeah. So my thought would be that both arms are up, supine, both arms up, head turned away from the affected side. Okay, treatment for a right upper
lot.
lobe tumor
Yeah, they do
has
a
the quad
lot.
at the central axis at the level of the sternal angle. The verification report will likely show the central axis is about the level of what? In other words, it's asking you what the level of the sternal angle is.
T4. Oh,
Yeah,
it's
they-
Carina.
Carina?
yeah, the rest of them are all pretty low.
Everybody agree with Carina?
Yes.
Okay. Yeah. What's another name for the sternal angle?
Sternal.
Called the angle of Louis.
Angle.
You've told us that so many times and I have not.
Right.
known.
If I like saw it, I would know. I feel like probably.
Yeah,
but-
it was on the
I remember-
list.
Yeah, like
Can you give us
if I
multiple
read
choice,
it,
please?
I'd be like that
With a
one.
tattoo on your head. Yeah. Sometimes they'll interchange it, sometimes they'll ask for standard angle of Louis, sometimes they'll ask for sternal angle, so it's something you should please try and remember. Because I know I've mentioned it several times. Okay, the beam on light outside the treatment room above the door is not on when the beam is on. Most likely the case is.
See,
C. Yeah.
welcome. It's nice of you to join us.
Surprise, surprise.
You know what's crazy? Is that on my GPS said I was gonna get here at 9:20. I was like, oh, that's when I usually get here when I'm late. But because there's so much traffic on the Parkway, I missed all the traffic on 95 North because it was already gone. But
Yeah,
usually there's no traffic on the Parkway and there's tons of traffic on 95 North.
yeah.
But I'm like, whatever. I can't. But supposedly somebody died in an accident this morning. It's been blocked off since 6 a.m.
Well, I'm not surprised about that.
And like 2 weeks
I
ago.
never heard anything. Usually they'll say it on the
The
local
news.
news, yeah.
But I texted my husband. He was like, "It's." I had to go straight this morning too. It's been blocked off since 6, before 6. But shoot, I can't breathe.
Sit down and get your bearings back here.
Thank you. AJSAIA.
They try.
Okay, so
did
let's, okay, ladies and gentlemen. For a clinical whole brain without the use of a face mask, before. The inferior border will be at the mastoid process and which other ones? You've got two.
2 and 3.
2 and 3. Everybody
Yes.
agree with that? Yes, no, maybe?
Yes.
Yeah, okay. So 2 and 3 and submit. Yeah. Distance from the source of radiation to the part of the patient's skin where the beam enters is called what?
It says
D.
A good surface landmark for the true vocal cords is what? Didn't we have a great discussion over this last night?
C.
You think it's C?
Yeah, I think that's what we said.
That's what
I'm proud of you.
we decided it would be. Okay, let's do C then. Yeah. True vocal cords are located about a centimeter inferior to the thyroid
Take a
notch.
picture of them.
Patients undergoing irradiation for breast cancer can be positioned which? So the positions are supine, lithotomy, prone, and lateral oblique. One, three, and four. 1, 3, and 4. Yeah. And everybody knows what the lithotomy position is, right? Most females know what the lithotomy position is. Yeah, okay.
Those are only ones, okay?
Precise
Throw those
precise daily reproduction of patient positioning depends on which two? Or which one, actually? So 1 is patient age, 2 is type of treatment regime, 3 is anatomical site treated, and 4 is patient overall health. Daily reproduction of the position.
I would say 3 and 4.
3 and 4?
Yeah.
Yeah.
Okay.
Yeah.
Everybody agree? Okay. 3 and 4. Over here. Yep. Depends on patient's overall status and ability to comply. Anatomical area treated, the integrity of the positioning aids and visualization devices, and the skill of the therapists. Which of the following sites is most likely to show bone metastasis? Most likely.
C?
C, Charlie? Everybody agree? You're right. Positioning the patient in a prone position means that the patient is
D.
D. If you can't get that one, you shouldn't be here, guys.
That's a good question that we should all get, I think.
Pardon?
I think that's a good question we should all get on the boards.
Yeah. The thing about it is it's too easy. That's the kind that sometimes you do it without
You
thinking
second
and then
guess.
get it wrong, you know? Okay. The output energy will be altered if which of the following device malfunctions?
I feel like it's C. I don't really have any good
C?
solid. Yeah.
Okay. Anybody care to disagree or agree or challenge that, or? C would be electron gun.
If not C, then maybe D, but I still.
I was thinking D too.
Everybody okay with C? Charlie? Okay. What else? What other one?
D.
D?
Yeah, that would be my second guess.
Okay. So D, I think more people have put D than, who's for D?
I don't know.
Everybody else is still on the fence.
Flip coin.
I don't have a coin.
You can put whatever you want, though.
Okay,
I don't
let's
think
see, let's
it'll-
do D.
Affect us too much. Nice.
So the answer is C, we should
That's okay.
have stayed with electron gun. So the output energy would be altered if
That one's
the
a hard
electron
one.
gun malfunctions. The electron gun is the source of electrons. And of course the electron is the source of X-rays.
I mean, no electrons, no,
No
no
X-rays.
go.
Yeah.
When treating the floor of mouth, oh, here we go again. The bite block may be used to, and I think we had a long discussion on this one too, didn't we?
Yeah. I still don't like it.
What did we go with? Was it C? I don't
Remember,
remember.
I can't remember.
I think that's what we thought it was, and then it was something else, and we thought that was stupid.
I think so.
Because I still
I'll
feel
do
like
it
it's
for
C.
Oh, wait.
Sorry, say again?
She said she thinks that we all thought it was C, and then they said it was wrong, and we all thought it was stupid, so C.
Yeah. I think if I remember correctly,
It's still good.
for some reason, I think it was A, but I don't know, to be honest, I can't remember. So let's just.
Bro, you got extra sweet cream.
There we go.
Just like the normal sweet cream, I want extra sweet
The
cream.
one that
because
makes so
cold
much
frozen.
sense, yeah,
Well,
okay.
for treating the floor of the mouth.
When treating the floor of the mouth, the palate may be spared by using a bite block to move the palate up and out of the way of the treatment fields. But also, if you look at, if you're doing floor of mouth, you want to treat the tongue. And the bite block will also depress the tongue into the treatment field, so I would say that they're both wrong. Depending on what you want to treat. 1 centimeter bolus is applied to an area being treated with a 6 MV beam. Maximum dose point will be calculated at B, 0.5. And why is that?
Because 6 MB is 1.5 centimeters, you put the 1 centimeter.
And then 1 centimeter bolus, yeah. 0.5.
You need a blank one? I have one.
What you looking for, Jeff?
Nah, I was just asking if she had an extra flashcard or something.
Oh,
I used to have a stack of, much appreciated.
okay.
What?
Reducing target margins does what? if you reduce the target margins, what are you doing? What can you do?
Yeah. Increase dose delivery.
Higher
to one
dose,
area.
why?
Because it's a smaller area, so you can get more.
You get more dose, yeah. The smaller the area, the higher the dose you can give.
There you go, you can have pancreas.
I'm gonna move these over here because I can't see you.
Oh, okay. I said B. That's why we're laughing, because I said B and I said the same time as Christina said because smaller area, and I said I read this yesterday.
Yeah, no, I just, like to see people's faces, so.
Oh, but now
Yeah.
you're blocking Steven, so.
No, I can see Stephen.
I'm kidding. I'm kidding.
Anyway, he sits quiet, you guys do.
We're discussing the answers, you know?
Yeah, I know. Okay. This is exactly the same as we did last time. Question 9, why are we going
We
back?
went with B, right?
I feel like they're pooled questions, it says 146, but it's really like 25.
Well,
Yeah. Yeah, for sure. It's like a question bank.
We just start at
Yeah.
the beginning every week.
Let me do this.
No, she goes
So we're
up
supposed
into
to be
different
starting
questions,
at
but some of these
1.6.
questions we haven't had yet. Some of these questions are new.
Oh, okay. Says we're on question 19.
I know.
Okay.
Okay.
I think they just change every time.
Let's start again.
Oh no.
That's okay. I'm just gonna start another one. Oh dear goodness.
Oh, silly.
Okay, so let's see what we can get to now. Let's. Hmm. Okay, a diabetic. This is patient care. A diabetic patient has been waiting for a long time and complains of hunger and dizziness. The therapist should do what? And this is not something that happens, it's something that happens quite often.
B.
So what should the therapist do?
I would get a nurse, but given the options that were
I mean,
Yeah,
I think you should just administer their
what
insulin.
would you do? If you know the patient is diabetic and they're complaining of dizziness and they've been, you know they've been there for 2 hours,
give them something to snack. B.
B.
I definitely wouldn't just blindly administer insulin.
I would.
I know how to. My mom's diabetic.
You're not allowed to, however, remember that.
I know.
Okay.
Warm
Being an
compresses.
asshole.
I'm
Yeah.
just being annoying.
We can rest, good breathing, everything, so, okay. A chemical substance used to kill pathogens on equipment is, or are, called what? Chemical substance used to kill pathogens on equipment,
1?
what would you call that? So 1, 2, or 3, or 1, 2, 3, and 1, 2, 3. Which one?
I'm not
One
looking it up.
disinfectant. I read this yesterday.
So A,
too.
B, or C, or D?
Okay.
Hey.
A.
A. Okay.
It says relating to or denoting substances that prevent the
What would
growth.
you use on a patient
Alcohol.
of those?
Oh. Antiseptic.
Okay. Sterile materials can be handled without contamination only by using what? So again, you've got a choice.
A.
22, so sterile
Mhm.
gloved hands and sterile transfer forceps. Yes. If it's sterile, you have to use sterile stuff. When your patient complains of dysphagia, you should advise him or her to
I mean,
Yeah, exactly.
what?
See the nurse. Right? That's great.
Okay, let's put it this
so
way.
like you can eat
Which one of
smaller
these would you choose?
smaller portions throughout the day helps
Yeah.
Yeah,
rather than just like trying to eat all at once.
okay.
But then
But
also,
also cutting food into smaller pieces.
but also taking
Analgesics.
Yeah. to
Or-
areas.
Sometimes they'll give
It should be all
an
of the
anesthetic
above except.
mouthwash.
I would probably say D, just because of the exam. But in person, I would probably say like A, B, and D.
You only have one choice.
I don't know which one I like, so I'm just
I
gonna sit
like
this one out.
I would go with B.
I think-
I would go with B too, probably, over
As in
D.
Delta.
I would go with Bravo,
B as in Bravo.
but they like D, so you can put whatever.
I don't know.
Big cuts.
I don't think it'll really harm us all that
Each
much.
smaller
If
portions.
we get it wrong.
I have an actual, like a question. Are we allowed to suggest that they take certain meds?
That's what I was
No.
saying.
Okay.
You're not allowed to suggest
I didn't think so.
take med, but if the doctor has prescribed something or the nurse has
Right.
suggested something, you can ask them,
Have
did
you
the
been
nurse give you anything for pain? Or did the nurse give you anything to help you swallow? Because there's something called magic mouthwash, have you come across that? That has a
Yes.
local anesthetic in it that helps them swallow. So, let's see, what the hell, let's do it this way. Yay, okay. Patient complaining of dysphagia has difficulty swallowing, yeah, smaller pieces of food. So no, you are not allowed to suggest, if the patient comes in with a headache, for example, and asks you what they should do about it,
See the nurse.
see the nurse. But if they're asking you, and the nurse is seeing somebody else, won't be available for 20 minutes, whatever.
Only 20 minutes.
You can ask them what they normally take for pain. And if they say Tylenol or aspirin or ibuprofen or whatever it happens to be, then has the nurse mentioned what you should take for if the headache is there? And they say, well, the nurse told me to take whatever I normally take, so that answers your question. But suggesting something is actually practicing medicine without license, so please don't do that. Okay. Malnutrition caused by
Physiological.
physiological change, sorry, or malfunction is called what?
I'm confused. Okay.
I've never heard of.
I don't
it
like
defined
the
that way.
verbiage of that.
That's so
It's so
odd.
weird.
Physiologic, basically that just means that whatever they're suffering from is causing the,
Yeah. Like a blockage or something, like a
not really, but
mass.
you know, if they're, sometimes if they're not able to eat because they're
Anorexia.
having a problem swallowing, or
It wouldn't
they
be
may
C,
become,
because that one
this.
is
and it's
weight
usually
loss,
just,
a general
It's-
state of ill health involving weight loss.
most of the time it is referred to as
It's a sign of
Um,
disease.
something that happens to a lot of
Cachexia.
cancer patients.
Is
I read it yesterday too. I just don't know. I read both yesterday.
it's often a sign of
Anything to guess?
C.
Go with A?
I like C personally.
Cachexia. But I read about A yesterday too.
My guess would be they want cachexia, but let's see. So Stephen has said
Alpha.
A, alpha. Anyone care to agree with them, or
We
Asia
like
has
C.
suggested
I
cachexia?
feel like Amasia is like covers all of them, so I'm just gonna go with D.
We're
If you're
covering all our
emaciated,
bases
it could be
here.
for any
Amasia?
reason.
No,
Hold on, hold on.
amasia is what happens when you have anorexia, cachexia.
Right, that's what I'm saying, it covers all of them, so I feel like that's playing it safe. I'm just gonna throw the dart at D.
So we have A, C, and D.
Yep.
I'll find out.
Would you like me to choose for you?
I think this is the
Sure.
most
I bet
divided
C,
we've
just
ever
because we've heard C
been.
so much.
Sorry, say again there?
I feel like this is the most divided we've ever been today.
I know.
We've never been so divided.
So anybody want to put their 2 cents worth in before I hit a button?
You can just
I'm
click
trying to
whatever
find
you
it. I'm
want.
trying to find it in my book. Trying to find it.
I'm
Okay.
gonna choose
I feel
cachexia.
like it's gonna take a lot
Okay.
longer, but okay.
Cancer cachexia is weight loss or malnutrition caused by some physiological situation secondary to cancer. Deodorant should not be used in areas treated with radiation because, and we may have a little discussion on that one, but let's answer the question
Huh.
first.
I think it's D.
I think it's D too because
I think it's
A.
Because it causes more skin reaction, so I would assume bolus effect.
no.
No.
what is that?
Chemicals in the
I mean, the
deodorant.
chemicals are being absorbed anyway.
Yeah, there is,
like the-
what's in deodorant that they don't want us to
Aluminum.
use?
Aluminum, that's why I said A.
Yeah, it's
scat.
metal, so that's the thing, and it does irritate the skin. I don't think you would cause it, increased scatter radiation, I don't think so. We'll cover skin markings, no. Chemicals in the deodorant may be absorbed into the skin. Kind of, because
Okay, but it'll do it anyway.
They're already being
Like,
absorbed
yeah,
when
if you
it
put
on.
deodorant on, it's gonna be absorbed into your skin anyway. So
Yeah.
I would go with
So-
D personally.
you would like D?
Yes.
Everybody seems to be pretty, okay, let's see. Yep, deodorant should not be used in the treatment because the skin dose may be increased. In addition, some additives in deodorants may increase skin reaction. So there.
So it's the additives that they're concerned with being a bolus?
It's the
I just can't
additives.
imagine, you have to have a lot of
Your
deodorant.
reasoning, King. Oh, good job.
You know that when you go for a mammogram, they don't let you wear deodorant also, right?
Yep.
I do not know.
I gave you guys a warning that I was having a mammogram a few weeks ago and I wasn't wearing deodorant.
She was gonna stink in class.
Yeah.
You were going to.
So why don't they allow you to wear deodorant for a mammogram?
Because it has aluminum.
And what would that do to the,
Well, it would show up on the mammogram.
Yeah.
Artifacts.
it gives artifacts,
Yeah.
basically, that's why they don't allow you to use it. Now, there is some patients who say, but I'm using the
Natural.
the natural one, you know, the stone, I don't know whether they still
There's
have
like-
the stone ones.
Charcoal?
Yeah. And like the
Charcoal ones
native
now and-
brand, I think.
Yeah, charcoal's a little iffy because, yeah. What we suggested to our patients, I know that several times, was use cornstarch. It's benign and it's gives the same effect. Okay, let's go ahead and do this. In order to evaluate the blood pressure, what is required?
C.
C,
C.
B?
Charlie.
Charlie, thank you. So somebody pronounce it for me.
Sphygmomanometer.
Yeah.
Sphygmomanometer.
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 Mo.
That too.
Sphygmomanometer.
Yeah.
Bruh.
Blood pressure gauge.
Not an N.
There you go, I like that.
Sphygmomanometer.
I took a patient care class years ago and she made us pronounce it till we got it right.
I just
Oh,
found
yeah.
it on a test once.
Oh.
Yeah, most places now have the fancy electronic ones, but you should really know how to use the sphygmomanometer. Okay, normal pulse rate in the adult.
A.
Everybody agree with that?
Yeah.
Yep.
Okay. Patient undergoing treatments to the oral cavity and oral pharynx will experience which of the following?
I guess D.
I think D, 1, 2, 3.
They wouldn't have cysts, maybe?
It doesn't,
I guess not. Okay, I go with D.
so what are we doing, I'm sorry?
D?
Delta.
Delta, 1, 2, and 3,
Yeah.
Yeah.
okay.
Oh, you don't like that.
No, I'm not saying anything,
Yeah, you, oh, you said everything.
I'm not saying anything.
Huh. Why didn't you like that answer?
I never said.
I saw your face.
It depends on how low you go in the oral pharynx, whether you have a sore throat or not, or difficulty swallowing or not.
I was thinking that
Because
too.
normally,
Yeah.
if you had, your oral pharynx stops about here, but it can go a little lower, and if it goes a little lower, then you may have difficulty swallowing.
Mm.
See, I thought
But,
about that, but they
I thought about that
wanted
too,
the
but-
only option, so I just knew it was.
Yeah.
Yeah.
and why wouldn't I have cysts in the mouth?
Why wouldn't they?
The only time you would have little cysts in the mouth would be if you have also got chemo, because that gives you mouth ulcers.
Yeah.
But it doesn't say anything about that, so.
Yeah. That's kind of what I thought too.
When assessing pain, the radiation therapist must consider the,
Probably all 4 of them.
say again,
Probably all 4.
all of the above,
Yeah. D. Delta.
D, delta, everybody agree? Okay, good. Following a seizure, the patient begins to vomit. The head should be lifted and turned to the side to prevent what?
Delta.
Delta. Actually, theoretically, you shouldn't just turn the head, you should turn the whole patient, right? Yes, ma'am.
I found the anorexia cachexia thing for you, Molly.
Read it.
And Stephen. Okay. Says anorexia is the loss of appetite that leads to weight loss. It leads to cancer cachexia. Cachexia is malnutrition and wasting due to an illness. So like an electrolyte imbalance, water imbalance, disease, loss of fat and muscle.
What page is that? You said?
I'm in this
She's
one.
in Laura's
Yeah, I got it.
41.
So cachexia is the covers everything one.
Yeah.
Is emacia in there at all?
I don't think
No.
so.
That's the first time I'd seen it, honestly.
No.
I would say that it's more emaciation rather than emacia. Emacia is not really what you would think of, it would be emaciation. Okay, so aspiration is correct. Okay, a pathogen among the following that commonly causes infection in the cancer patient is what?
Streptococci. I had strep 4 times in 1 year once.
Gross.
I was in the
Yeah.
Navy and I was coughing up blood every time. So it was the Navy's fault.
You should have immunosuppressed.
Yeah.
Charlie.
Charlie?
I like
Staph
Charlie
aureus?
too.
Yeah.
Yeah.
Staph, not strep?
Staph, but from what I've been told, is all over your body all the time anyway. So
Yeah.
if you're immunosuppressed, you're more likely to
Yeah.
get it.
So staphylococcus.
It's the same thing.
Okay.
Oh, okay.
Pseudomonas is a
Oh.
Christina,
bacteria
pronounce
that's
it.
commonly an
Pseudomonas.
agent of severe nosocomial infections.
Oh, that makes
So have you
sense.
heard of MRSA
Finding
and
the
C.
that.
diff, that type of thing?
Oh, C. diff. I have that regularly. No, I'm kidding.
Oh God.
So learn something today.
Get out of here. I've never heard of that term.
Me.
Yeah, that's the first time.
Good to know.
Let's
Good
find
to
that in the
know.
book too. Okay, ready?
Go get it.
Pseudomonas.
I feel like Laura needs an electronic version of her book. so
Staphylo-
people think that-
Yeah.
I did a thing in high school that regarded like the staphylococci. There's one that's like Staphylococcus aureus,
Yes,
something like that. That's the
aureus.
one that like.
Yeah, that's the bad
causes
one. Yeah, Staphylococcus aureus, yeah. That is a bad one. And that's also counted a nosocomial infection. Five stages of grieving were identified by whom?
See,
See?
Yeah.
Elizabeth Kubler-Ross, Kubler-Ross,
No,
yes.
they-
Her book
one
is,
can,
her
Dabda.
book is absolutely amazing, if you've ever read it.
What's
I
her
would
book?
suggest you, if you can find it,
What is it?
get it out of the library or whatever you do these days.
What's
What
it
is the
called?
title?
It's called Death and Dying.
Wow.
Sounds very cheap.
Sounds
But
great.
It's actually an excellent book, especially if you're in this field, because it covers also, deadly illnesses and stuff.
It's only $13.99 for the ebook. It's not bad.
Yeah, and you can probably get it on some other, you can probably, yeah, I'm gonna do this, sorry, I'm gonna do this.
First dude is like made a measurement, a dose or something like that.
Okay, proper nutrition for the cancer patient undergoing radiation therapy treatments helps to do what?
Two and
I like
four?
2 and 4.
2 and
Me
4.
too,
So-
but that's not an option on there.
I don't.
I think it's
It could. I feel
1,
like
2, 3,
maybe
and
it could enhance the effect
1, 2, 3, and 4?
of the treatment.
or it's either
1, 2, 4.
C or D.
Yeah, I feel like.
I'm going all in.
See, I don't like one, but.
I think
I like
Going
1 better
I'm
than
going
3.
Charlie.
I'm going Charlie too.
1, 2, and 4?
Charlie.
I mean, food is not going to divert the patient's attention unless
No.
they're actively eating during treatment,
Yeah.
which is
That
not
would be a little difficult.
the case.
Yeah.
Yeah,
Yeah, I like Charlie.
so Charlie?
Yeah.
Yes.
I saw Total Skin.
Okay.
It was really scary.
In case of an emergency, a patient with advanced directives does what? Or has what?
6.
G Delta.
Delta, I have instructions about care. Everybody agree with Delta?
Yes.
In case of an emergency,
Hmm?
the patient. I have to reread the question again. and again and again.
Yes, it's D.
Yep. A drug that would increase the flow of urine is called what?
Diuretic.
Bravo.
Diuretic.
Bravo.
Yeah. Okay.
Diet Coke is a diuretic.
A patient is experiencing a severe reaction in the perineal area. They should not do what? They should not do what?
Not
Mm.
A. They should not take a hot bath, right? What? Like, no, like A.
A?
Yeah,
For sure.
I like that one.
I would
A.
not.
I don't like the not and then the decrease. I didn't like all that, but
Should not.
here we go.
What should they do?
Keep the area dry.
They should decrease the likelihood of repeated friction and they should decrease the likelihood of prolonged moisture.
So keep the area dry.
And
Maybe it's
Moisture, but not
If they-
bath.
wet.
How do they manage to get rid of the, is there anything, because with a severe reaction in the perineal area, they would be extremely itchy. So has anybody heard of sitz baths? Sitz, S-I-T-Z,
Yeah.
sorry, H-S-I-T-Z,
Maternity
baths. Basically, you, strange thing, you actually have a,
Oh,
what,
I looked it up.
did you look it up?
Yeah.
Read out what it says.
Oh, it showed me a bunch of pictures. Promote the healing of an anal fissure by soaking the rectal area in a tub of warm water.
I don't think I've heard that.
Like a light though.
Nobody heard that. Yeah, basically.
You
it's-
sit in
you
warm
get
water.
a small basin and you basically sit your butt in there. And sometimes they'll suggest something like salt or something like that will help them. And it's usually warm, either lukewarm or warm water, never hot.
They recommend that after you have a baby.
It seems so small.
What?
The-
You can make a sitz
little
bath in the
container.
tub too.
Yeah,
you
you
don't
can.
have to.
Well, I'm just saying,
Oh.
like what they sell for it just seems so small.
The proper sitz baths are like a
Oh, it says it fits standard toilets.
yeah,
Never
you can
mind.
use
It looks
standard
really
toilet,
small on
yeah.
here.
The sitz baths that I
Those
remember
are like the pink things that
seeing
they
or
give you in the
giving out to
hospital.
the patients were like
You pissing? You piss on me.
Yeah, well, women. Men have other things.
oh,
I don't know if I'll fit in
Anyway.
there.
So in a basin of some sort, okay. Contact with secretions transferred
See.
by sneezing, coughing, or talking is an example of which kind of means of transmission.
See. Charlie.
Charlie, drop it.
I can remember.
Yes. If there's a serious complication during therapy, a patient could initiate legal action against
D.
all of
D.
the above.
I want to say D.
All of the above? 1, 2, and 3?
I mean, I feel like they can go after
During
whoever they want,
therapy.
really.
They normally go after who has the most money, which
The
is who,
doctor.
but
The hospital.
I was thinking
Oh,
the
if it's a
hospital.
hospital, yeah.
Yeah.
If it's a hospital-based system, they'll probably go after the hospital. If it's a doctor-owned center, they'll go after the doctor, but they usually sue
could.
everybody.
Yeah, go on.
Yeah.
3 then.
Yeah.
So A, B, and C, or D?
Just to see what sticks.
Yeah,
Yeah.
High, hit low.
Yep.
Okay, yeah.
yeah. Okay, one more, then we'll go to break. Normal body substance released by tissue in response to an allergic reaction is called what?
A.
Everybody agree with A?
Yeah.
Histamine.
Christina.
So let's leave it there. Let's go for a break. I'll see you back here in 20 minutes.
Ooh. So pause it.
And if
Please,
I
my
may-
life.
I am.
We also cannot properly like.
Most common means of spreading infection.
See. Damn it.
See?
Kidding. Kidding.
Yes.
Domestic.
Which of the following foods should be avoided by patients receiving radiation therapy? To the pelvis.
Interesting.
What?
Corn. Maybe corn, because then you know when you eat corn, you poop
Corn
out
don't really
corn.
digest.
Yeah, because you know.
Which of the following foods should be avoided by
And raw
patients
vegetables.
receiving radiation therapy?
I think I
C.
like raw
I'm gonna go-
vegetables.
I think C.
One, I'm gonna go, I don't know. Oatmeal and veggies I've always been told is good for you.
Raw veggies.
But
though,
raw
Steven,
veggies, yeah.
But remember, what are you trying to avoid if you're treating the pelvis?
Maybe
I think it's C.
oatmeal.
I'll go see.
What if it's
Yeah,
all of
1 and 3 then.
I know. What if
I
it's
know,
all-
I'm like,
Oatmeal is whole-
Oh, it's multiple and, oh.
it's good for you.
Oatmeal's good. It's soft. Everything.
You can eat oatmeal
Yeah.
raw.
But
but
what
I
are
bet there's
you-
something in oatmeal.
Let's go back to my first question.
Yeah.
What are you trying to avoid giving the patient if they're treating the cervix? What are the side effects of pelvic radiation? What's the main side effect of pelvic radiation?
Diarrhea.
Diarrhea. So you're trying to avoid making any diarrhea worse.
So oatmeal.
So, which one of these would you avoid?
Maybe corn, because I feel like.
I mean, corn doesn't give you diarrhea. Corn
But I
just
feel
doesn't
like it
digest.
just comes right out of me, you know,
No.
immediately.
It's very much an individual thing, but there's a
Yeah.
set, there's a set
I like 2 and 3.
certain things that you suggest not to have.
Maybe
One
three.
is raw vegetables. You can have, to a certain extent, cooked vegetables. But remember, raw vegetables have a lot of fiber,
Yeah.
and they're on a low fiber diet, guys.
I feel like all three of those
Okay,
are high
so
fiber
B as in
though.
Bravo.
So then maybe D.
B is in Bravo, 2 and 3. What
Sure.
about the corn? Isn't the corn fiber?
I'm about to look that
Doesn't
up.
completely
Corn is a
digest.
starch.
Eat corn.
Yeah.
Okay,
Corn is
so
rich in fiber. It's
Okay.
the first sentence.
Okay,
1,
D,
2, and 3.
Delta.
1, 2,
Delta.
and 3.
Sure,
Okay, let's see.
All of them.
All right.
Good job, guys.
I was gonna say, whenever I eat
Remember,
corn, it
one of
literally
the
comes
things that
right
we
out of me.
don't say
I don't even
are-
like think
Not
twice.
digested at all.
Yeah.
Are no whole grains. What is oats? Whole grain.
I have to go right now.
Okay.
Let's get it. Just take a picture, please.
You know,
All
I
this
should
poop
know.
talk
I
making me
know.
gotta poop.
Diarrhea. It's making me have the diarrhea. It's a,
Okay. Characteristics of cachexia include all of the following except
bravo.
A.
Oh wait. Oh
A,
sorry,
yeah,
sorry.
A.
Except A. Except alpha.
Okay.
What is satiety?
Sadie.
Sadie?
Oh,
early
feeling
satiety. It
Oh,
means
okay.
you're full before
Yeah.
you should be full.
And what about
What is
asthenia? Asthenia?
Asthenia.
Asthenia. What is that?
Asthenia
I've
is,
heard of
look it
it,
up.
but I don't.
Asthenia is,
It is abnormal physical weakness or lack of energy.
there you go.
I mean,
See, and you want to take our phones away.
No, I just don't want you
They're-
to use them for other things.
They're effective, you know?
Yeah. Measuring the heart rate by using a stethoscope over the patient's heart is an assessment of which pulse?
bravo.
Sorry? I didn't-
Bravo.
Bravo? Everybody
It's
agree
not the
with bravo?
carotid and it's not the radial.
And
What
I've
is
never heard
pituitary?
that
Okay.
one. The,
Oh, that makes sense.
Yeah.
Thanks.
So apical?
Yeah.
Yep.
C.
Yep.
Okay.
Say
C is a yes.
Steven.
no, Steven. Shut up.
Normal range for platelets in an adult,
Oh, hell.
Asia.
Wait,
D.
What?
Delta. Oh wait, hold on. So I don't know. They told me 150,000 to 450,000. So million is five.
D is thousand.
Oh,
Yeah, you
oh,
just
okay.
said
D.
it.
Yeah. I keep reading million now, but it's D. It's
I did the
Delta.
same thing. I was like, wait, a million seems like a lot.
D.
Delta.
Thank you. Okay.
Mine is at, like-
155. Is it, most of the books say 150,000 to 450,000.
But mine are like A. So.
Oh my god.
So,
Yeah.
How are you alive?
because if they're not zero, you're alive.
Mm.
You can still be alive
We'll
at zero.
tide her if she knocks anything on her leg or anything like that.
We'll be very close to death if I.
Okay. When a patient is receiving oxygen, it's important for the therapist to do all of the following except.
Carry on.
A, yeah, what?
I ain't looked at the other option. I just looked at A.
I still wanted to, just in case there was something wilder out there.
My favorite thing about this is it comes from.
So
the
everybody
sea.
read
You don't
the
have that
name.
good shit on the floor.
I
saw this in
know.
the
Proton has it on the wall.
Okay.
Yeah. And Gainesville is
There's a take on the floor.
Okay. A persistently high arterial blood pressure is known as,
hypertension.
pardon?
A.
A, hypertension. Yep. Volume percentage of red blood cells in whole blood per 100 ml is the what? Something we don't check very often in the trial.
Yeah, I think so. It's definitely C or D, but I think it's C too.
Anybody get any idea before we start looking up what
The
forms?
volume percentage of red blood cells.
The volume
Yeah.
percentage of red blood cells in whole blood per 100 ml.
Well,
I think it's
A is
hematocrit.
red blood cells. B is white blood cells.
Yeah,
Hemoglobin. Hemoglobin is
C.
in the blood. It's C. Right?
yeah.
What is it then?
Oh, yeah.
Charlie,
What is it called?
Hematocrit.
hematocrit.
Thank you.
Hemoglobin is a thing in the blood, right?
So it's the percentage
Yeah.
of red blood cells in the whole volume.
Hemoglobin is a protein, I believe.
Is hematocrit. And normally you would get hematocrit readings if you were on blood thinners. Because it affects the hematocrit.
Charlie.
Okay, if you are helping a patient who has suffered a stroke, you should position yourself where?
C.
Charlie.
See again?
Charlie.
Charlie? On the patient's
Charlie,
weak
bit
side?
A.
Do you agree with that? Okay. Regarding management of skin reactions, all of the following are true except.
Oh my god. I almost said D, but then it said avoid it. Never mind.
There's one that stands out. guys.
Alpha. I don't know.
Alpha?
I don't think you should keep it
Anybody agree with
moist.
alpha?
I don't think.
The first one, I mean, out of all of them.
But if you're head and neck, they give you that.
So that,
Yeah, and
is
for
that the odd one out?
But you don't.
So you have prevention of further injury is best,
Obviously.
Yeah.
obviously. Cornstarch may bring some relief.
You just said that.
It does, yes. Heat and sunlight should be avoided.
You-
I feel like that too.
But it's except.
Oh.
Oh,
Yeah, so what's the odd one out is what I'm saying.
All of them are true.
B.
No.
It says all of them are true
Following are
except.
true.
All of them are
except
true except which one is the odd one out?
A.
A.
You do not want to keep it moist
You do
because
not want to keep an area with erythema moist.
Then why do they
With
give
the
creams
cream?
to everybody?
Pardon?
cream is different.
Cream is different because you put it on and make sure it's absorbed and it's never moist for any length of time. That's how it should be used. If it's used otherwise, then either the patients aren't listening to the therapist or the nurse is giving them the wrong information, or they're mishearing, shall we say.
If it's kept moist, can't that affect their treatment?
It could make their worse, I would
Yeah,
think.
it
It would
could make
make
the
them start like
reaction
peeling
worse,
and
yeah.
shit.
Well, it's definitely not supposed to be
So,
moist
we're
during
gonna-
treatment.
Okay, about 1 week after the infusion of certain chemotherapy agents, the skin in a previously irradiated area may show signs of erythema, blistering, and pain. The phenomena is known as radiation what?
B. Bravo.
Bravo, recall.
How are we back at 31?
Occasionally it does that. It's,
Started over.
It's strange when it happens, but it does happen. Which type of patient would make it unsafe to use a glass thermometer to measure body temperature?
C.
Charlie.
You only
I
get
guess.
one choice.
C.
C?
Yeah. Best answer.
If you got more than one choice, the other one would be appropriate.
Not adolescent.
Disoriented
Just be
is the
crazy.
one.
Adolescent's like an adult kid.
Okay, your patient
No,
has
adolescent
a
is a kid.
continuous infusion chemotherapy regulator. During treatment, the regulator apparatus begins to alarm. What should you do?
Pull the catheter out and reinsert it right there.
Wow. These
Charlie.
options.
Charlie? Okay.
Just silence it.
So the nurses always do.
I know, right?
Yeah, the nurses always do. So officially, ladies and gentlemen, what should you do?
Charlie.
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 They usually just ask, is
Scream.
this normal?
Scream
And
like,
they say
like
no.
people at
Pretend you don't hear it
When
and
I
walk
won,
away. Why
okay?
is that not an option?
You go onto the intercom and you say, nurse still enact whatever stat. Yeah, that doesn't help either, no.
They did that on
A lot of
patient,
people
too.
would
Patient was still
silence the
sitting
alarm
there.
until the treatment is completed, but.
I was
They
like,
did
chill.
what?
They all freaked out in front of the patient too.
Oh my god.
I was like, chill out.
Okay, here we go. When moving a patient, the radiation therapist should keep in mind the following principles. A narrow base of support will provide greater stability in lifting against gravitational pull. The closer the body, the weight is held, the more weight can be moved. The farther from the body the weight is held, the easier the weight can be moved, or the pulling or sliding of an object requires less effort than lifting against the force of gravity. So which ones are true?
Bravo.
Bravo, so
2 and 4.
four.
Yes.
The closer and the pulling or sliding, everybody agree with that?
Yes.
Yeah.
Okay, 2 and 4. If an area is to be completely free of pathogens, you should follow what? Completely free of pathogens.
I don't know, man.
Asepsis.
Alpha.
Well, like if you're going into surgery, you have
Alpha or what else?
like the blue stuff you can't touch.
Touch, yeah.
I like
A.
A.
Okay.
But then I've also heard of clean technique,
So
and I don't know what that means.
Probably
like
would
clean
be
and dirty
Alpha
therapist.
or Charlie.
So, but if it's to be completely free of
Yeah.
pathogens,
Completely free of pathogens.
I like A.
A.
We like A. We'll go
We
with
like
that.
A. Okay, let's go with A. Surgical.
If you go
And
into
then the area
surgery,
needs to be completely free of pathogens.
you can get like a
A
surgery
low
incision site infection, right?
residue diet would be
Right.
recommended for patient receiving radiation to the, we just discussed this, guys,
Esophagus, bladder.
bladder.
I just read the first thing I looked at out loud. Okay, wasn't my answer.
The purpose of isolation is to prevent all of the following except
D. Oh, wait.
See,
I like Charlie, I think.
Charlie?
Self-contamination of the patient.
Yeah,
Yeah, that doesn't make sense.
Charlie.
You can't
Charlie?
contaminate the patient from their own organisms.
How does that make sense? Like what?
yeah, that doesn't make sense, does it? No. Through which route are most drugs excreted from the body after metabolism?
Liver,
This is a gimme.
kidney, or liver? I mean, you know when you have drugs. Oh, that's alcohol, huh?
Well, it gets filtered through the kidney and excreted through the bladder.
Drugs. Okay, well it's not B or D.
I mean, it can go through.
I was gonna say.
It can if you're
Yeah.
sweating,
Yeah.
but that's not saying anything about
What
sweating.
is
Most
the
drugs are excreted.
most drugs excreted?
Kidney.
Kidneys.
Yeah,
Most
liver-
drugs
liver
are
failure is
excreted through the
alcohol or
kidneys.
some shit like
As you become aware that your patient is positive for MRSA, you should prepare to care for him or her with
Wouldn't it be
Gloves
gloves,
and
gown, and goggles?
say again,
Wouldn't it be gloves, gown, and goggles?
glove, gown, and goggles.
That's not an
Okay.
option,
It would
though.
be definitely gloves and gown because MRSA is spread by touch.
Yeah.
A.
Yeah, I mean, if we're going with the best answer, it'd be A. However,
So gloves, gowns,
just, you know.
well, there isn't one that says
A.
gloves and gowns and goggles.
Nope.
It's alpha.
So gloves and gowns,
If we're going with the best, it's
Yes.
A.
yes.
The best
So MRSA
offered.
transmission is currently transmitted through direct and indirect contact, so gloves and gowns. Lithotomy position would be the appropriate to examine what?
B.
The oral cavity.
Oh, my.
B.
Yeah, okay,
It'd be a long look. You need a microscope.
so which area?
Bravo.
Bravo.
As soon as I saw oral.
Palliative treatment,
B.
D,
B.
Bravo.
Bravo.
Okay.
Okay, just checking, make sure you know what you're talking about.
Treatment for prevention of the spread
Why
of
not?
cancer.
Okay, direct. During injection of contrast for CT sim, your patient complains of difficulty breathing and feeling faint. He's likely experiencing what?
Claustrophobia.
I mean, shit.
A.
CT Sim complaint. Oh, I thought you were being serious.
Difficulty breathing and feeling faint.
Respiratory distress.
A. It's A.
A,
Because of the contrast.
right, okay,
Did it say contrast?
so wouldn't it
Yes.
be?
Oh, contrast.
That's not a
Yeah.
minor.
Okay.
No.
Prophylaxis
It's
then?
okay. I wasn't reading any of that either.
I was
I'm
like,
like,
what?
what are we
Everybody
talking?
agree with A?
Yep.
Okay.
Could also be claustrophobia, but you know.
Enteric precautions must be taken when dealing with. First of all, you have to figure out what enteric precautions are. What are enteric precautions?
Can you use it in a sentence, please?
If,
Intestines.
Okay, so.
yeah,
Vomitis.
I was gonna say, think about enteritis. So, what would it be?
Fecal material. I was about to say matter.
Fecal material.
I mean, it works.
Were you there when
Fecal
Mary
material. Yeah.
No, but I heard about it.
Who
So it was Mary.
Deficiency in the
Mary
number of
Mary Ann.
circulating
Oh, yeah.
white blood cells is called what?
I don't remember. I don't think.
Leukopenia.
But no, I was
Penia.
Let's see. Okay. What's pancytopenia?
I
You're
don't
correct, but what is
I
pancytopenia?
don't know.
Low everything. Low everything. Yeah.
Leukoplakia is like the dying, the killing, right?
The stages of coping following the diagnosis of cancer include all of the following
D,
except
delta,
Delta.
dabda.
What?
delta.
That's the 5 stages. Actually, has it changed? I think it's changed now. 5
I think it's
stages.
got 6 now. A form of anti-cancer therapy that uses the body's own immune system will often require the production of what?
Mm-hmm.
Yep.
Charlie.
Charlie?
What does attenuated mean again?
Antibodies.
It's like loss of. Depending on what you use it in.
New patient arrives in a wheelchair and is unable to stand. The best transfer method among the following
Little
would be
boy.
what? Delta? Okay.
Yeah.
He is unable to stand.
Are you transferring just from the chair to the bed, or does it tell?
Doesn't say.
Doesn't say.
Patient arrives and he's unable to stand, so presumably you need to get him from the chair somewhere.
A lift?
Yeah,
I mean-
probably the lift.
2 to 3 person lift.
That's a lot of body.
Yeah, that's what I.
Because they tell you with a wheelchair,
Yeah.
you need a
They
minimum of one
deadlift
person.
one
It
patient
depends
at
on
one,
whether they can
like literally
stand. If they
just.
can stand, you can do it with one person. It's safer if you have 2 because one can move away the wheelchair once the patient's standing. But if the patient is unable to stand,
Yeah, you wouldn't be able to use the gait belt because that requires them to stand on their
that
own.
requires them to stand. Yeah, the gait belt always requires them to stand.
Well, we have a guy that's paralyzed from the chest down, and he uses a slider board.
Does he come down in a wheelchair or a stretcher?
Now, he comes down in a wheelchair, and he's got this, like, it almost looks like a skateboard, like
Oh,
that.
Yeah,
it's
small
actual
one.
plank
Yeah.
board, like
Yeah.
I've seen those.
Yeah, the small sliding board. They've got some in PTA. I think we actually saw that when you were doing, with Dr. Mack, you were doing your movements.
So then it's A,
Pardon?
so then it's A, 2 to 3
Everybody
person.
agree with A?
Yeah.
I guess.
Okay.
I'm in a wheelchair.
Yeah.
Okay, so we have this one patient who has one arm, like he's